you. Hello, welcome everyone, and welcome to this first set of parallel sessions called Roads from Research to Reality. And in particular, very warm welcome to this session that will focus on artificial intelligence serving healthcare. So we are in the session of healthcare today. I'm Ana Garcia. I'm serving the Big Data Value Association, BDVA, as Secretary General, and I will be your moderator for these 90 minutes. And I will tell you why this is important for me. As our organization is an industry-driven research and innovation community working with data and AI, of course, this important point of how to really ignite excellent research into competitiveness is key. And then if we look at the very active domains verticals, healthcare is one of the most active ones in our community. And now, when we talk about healthcare and we talk about the transformative power of AI, so clearly healthcare is one of these exciting and very important domains. And why is that? Because healthcare is the basics, is one of the basics of our societies. And healthcare is really something that affects us, all of us. All. And then clearly, and it was very good that the CEO of IMEC in his great speech put on the spotlight healthcare and really how chips, how data manipulation, how AI is bringing so exciting new applications on the domain. But we all also know that healthcare systems are facing many different challenges, right? So artificial intelligence and data can really help us to address those crucial issues, but also they bring a lot of new challenges and many benefits. Benefits on the medical side, so you will hear that, of course, there is a lot of improving diagnosis, improving decision-making, improving precision in surgery, many things, but also bring benefits to economic and society. There is a lot of efficiencies as well that artificial intelligence can bring to us. Now, what can you expect from this session? What are we doing in this session? Because, of course, the topic is broad. We will cover two main pillars. And one of the pillars that is a bit more generic, but is important, is how advanced digital tools, technologies, of course, data, artificial intelligence, but we cover also computing, connectivity, and advanced digital technologies as a whole, how they are really benefiting the sector, but how are benefiting the hospitals, the patients, the researchers, the government, because this is a very multi-stakeholder domain. And then we have a second pillar, that is how the programs, the European programs, Horizon Europe, Digital Europe program, and other programs are really helping us to address these crucial issues, but also building synergies in between the different programs. So really to remember, we go road from research to reality. How are we doing this? We will have two parts in this session. The first part is a bit like the learning session, and then we will have the discussion. So in the learning session, we will have three presentations. The first one, it comes by the European Commission, and we will learn how Horizon Europe and Digital Europe program, also their programs, are really helping on this domain of AI for healthcare. And then we will bring two case studies, two great initiatives that are really showcasing this path from research to reality. One is EUKIME, and you will learn a lot about it, that is really developing federated data infrastructures for cancer imaging, and also supporting the deployment of AI-based solutions based on this infrastructure. That will be one of the cases. The second one will be testing and experimentation facilities for health and healthcare that also focus on intensive care and cancer, and really will be the one deploying these trustworthy AI solutions and accelerating the innovative solutions into the market. So we will have these two presentations, short presentations. Then we come all into the panel, and together with you, we will be talking about what are the synergies, what are these learning paths, what have we learned with these initiatives, what is really meaningful to take into account for the future, and we will also talk about sustainability. And we hope really you can interact with us in that part. And now, with no more delay, we will pass into the first presentation. So I would like to invite on the stage Saila Rinne. She's part of the European Commission. She works as acting head of unit in the unit H3 in DG Connect that looks after e-health, well-being and aging. A big applause for Saila. Thank you very much.
Thank you. So good morning, everyone, and welcome to this session on data-driven solutions and AI for healthcare. From the Commission side, we are very happy that the Belgian presidency agreed to organize this breakout session together with us, because we think there are great examples we can show you and discuss with you that are really tackling this issue of bringing research results into deployment and ultimately to the clinics. Anna already mentioned the great societal impact and potential that AI and data can bring, and this is also a very important aspect in this application area, and also the sustainability of all the work that goes into and the funding that goes into both research and deployment. The sustainability issue is something that we are also going to tackle today. That is really one of the most difficult parts. You may well know that the European Commission is funding under Horizon Europe research actions, and then we have Digital Europe program for deployment of mature technologies. When it comes to AI and data for healthcare, we have projects funded under Cluster 4, Digital Industry and Space, which are focused on AI and robotics and building data and computing technologies that are helping also healthcare. Then under the Cluster 1 Health, we have also topics and projects working on new tools, technologies and digital solutions for healthy society. For example, data-driven decision support systems for prevention and many more. So there is a lot of funding for research under Horizon Europe for AI and data for healthcare. Then on the deployment side, under Digital Europe, we have health data spaces with 3 federated infrastructures for health data, including genomic data, cancer imaging, and intensive care units data. Then we are looking at testing and experimentation facility for health that we're going to also hear more about very soon, which is about bringing AI solutions from the lab to the market, also in the field of healthcare. And finally, we have the European Digital Innovation Hubs supported from the Digital Europe program that are fostering also uptake of health solutions. I would like to now very briefly mention 3 examples where this research to reality is actually already happening. The first one is about genomic data. We have the 1+ Million Genomes initiative that was signed by member states already back in 2018. So there was a strong political backing for this initiative. Then we funded from Horizon 2020 a coordination and support action that was looking at the legal and technical requirements and that we need in order to deploy genomic data in a federated platform, which we are now funding under the Digital Europe program. It's the European Genomic Data Infrastructure project. On top of that, we are going to next fund a Genome of Europe project, which is about genome sequencing, so bringing more genomic data into the infrastructure. And then the timeline is to have this infrastructure ready for deployment, and hopefully then again we need to talk about the sustainability part, and the timeline now is until 2026. That's the current roadmap, and the member states have been supporting this work all the time. So this is very important that there is the buy-in from member states to do this. Just to add also that under the genomic part, we also have member states who had applied or are using genome sequencing in their national plans for recovery and resilience facilities. So this is also a complementary funding source for this big initiative with common goals. Second example is much more fresh. The initiative was launched formally in December 2023, so a bit more than a month ago. It's about the European Virtual Human Twins. So here we are talking about a digital representation of human health or disease, and these twins are built using software and models and data, and can be used for clinical support in care delivery, clinical trials for medicines and devices, medical training, and so on. So great potential in terms of advancing healthcare. Here we have been funding under the Digital Europe program a coordination and support action that has helped the Commission to build the ecosystem around this initiative, and also looking at the roadmap ahead with the initiative. Now we also have 8 research and innovation projects starting right now under Horizon Europe in order to advance the state of the art of these models and this technology, and feeding into a platform that the European Commission is procuring under Digital Europe programs. So this is a bit different approach from the genomics, but again, building the ecosystem and community of stakeholders around it is extremely important to have that backing, and then have research results feeding into deployment actions. The third example is about cancer imaging, European Cancer Imaging Initiative, which is one of the flagship initiatives of the Europe's Beating Cancer Plan. We will hear more about it very soon. I won't spend too much time on this, just to say that here the approach was to use research results from H2020 projects. We had 5 of them working on different cancer types, bringing concrete clinical use cases into the federated infrastructure under Digital Europe program. Finally, I would like to also mention the Connecting Europe Facility funding program, which is perhaps a bit less known for this community. Here we are talking about smart communities projects. Some of them are related also to healthcare sector. And it's about implementing 5G networks for e-health services, video consultations, real-time remote assistance, and connectivity in emergency vehicles and between doctors in hospitals. I would like to finish my speech with a few words about the way ahead. What are we expecting in the next few years? So the European Commission has adopted major regulatory packages recently, which will affect also research and deployment in AI in healthcare. The AI Act complements existing sectorial regulations, such as the medical devices regulation, by providing additional safeguards for safety and respect of human rights when AI systems are used. On the data side, we have the Data Governance Act, Data Act, and the currently negotiated European Health Data Space Regulation, which all affect also healthcare sector very strongly, and they need to be taken into account as soon as we know exactly what these regulations are going to look like. Then when it comes to technologies, we are seeing very fast-paced developments that are also coming to the healthcare sector, and especially the potential of generative AI for healthcare is very high on the agenda. And this is really an opportunity also to bring together all these initiatives that I just mentioned, using the data from these different federated platforms also for developing generative AI solutions for healthcare. We have also great HPC, high-performance computing capacities in Europe that can be used in this context of generative AI solutions. 2 weeks ago, the Commission published a comprehensive innovation package to support AI startups and SMEs with a broad range of measures, and there as well in the communication it was mentioned that health data spaces such as the genomic data infrastructure, cancer infrastructure, could be contributing to the future generative models for healthcare, and the Virtual Human Twins initiative could use these data spaces to train also generative AI models. Finally, both when it comes to both research and innovation and deployment, there is one thing we really need to pay attention to, and this is the ecosystem approach. We really need to have all stakeholders on board: researchers, innovators, healthcare providers, data scientists, patients, healthcare policy makers and member states. This is the only way we can move forward and be sustainable in this area. So we need engagement and buy-in from national, regional and local actors, and also in order to ensure the long-term sustainability. I see this happening already, and I'm very optimistic that this will really happen in the next few years. And I really look forward to hearing the thoughts of the representatives of these initiatives I just mentioned and the discussion ahead. Thank you very much.
Excellent. Thank you very much, Saila, and thank you for your applause. And really great. I think we all appreciate it very much to see these roadmaps, no? What we see, what has happened in the last few years, and we see how this has been projected towards the future. Also, thank you very much for giving us some insights on what is coming up now in the next few years with generative AI, and very much support this ecosystem perspective that actually will be critical for sustainability. Still not sufficient, but critical. Okay, so now, as we said, let's go to the second presentation, and now we go to the specific cases, and then we start with UKAIM. And I would like to welcome on stage to Luis Martí Bonmatí, who comes from Spain, from Valencia. He's the coordinator of the UKAIM initiative, and he comes from the Hospital La Fe, and also he's directing clinical imaging department and research. Welcome on board, and please big applause for Luis.
Well, thanks a lot, Anna. I will try to summarize in these 10 minutes what's UKAIM, but I will start with big numbers. Every year, close to 160 million medical images are obtained at the European level, and only 1 million from those are used for research. And once the research projects finalize, all those images will disappear. And what I'm willing to summarize here is how the UKAIM network and research collaboration is willing to avoid this fragmentation. Also, I will share some big numbers. I mean, we have been working from those millions of images at the radiological level to evaluate patients. And thanks to medical imaging, we know which are the diseases, where the tumors are located, the size, number, extension, and in some way grading and staging of these tumors. But even more important, on the last years, with the use of computers, we were also able to extract meaningful information from images in an objective way, what is called radiomics. And radiomics, together with genomics, proteomics, and metabolomics, linking all those pieces of information together, are the foundations of precision medicine. That means obtaining diagnostic and prognostic information from that network of dimensionalities that will tell an individual which is the expression of the tumor in him or herself, and not treating patients as populations, but treating patients as individuals, because the different treatments, the drugs, the surgical approaches, the interventions will be different. So to do that properly, we have to recognize we were facing different troubles, and that's why the AI for Health imaging was constructed thanks to the European Commission some years ago. Main troubles to obtain meaningful and reproducible information from medical images to be used for research, to obtain prediction models to know what's going to happen with an individual person having a tumor. Main troubles were based on reproducibility and also on the access to data. And on the reproducibility part, we were working on harmonization. Meaning taking out the influence of the machine, the protocol, and the version to obtain the same radiomics every time we do evaluate a prostate tumor, as an example. And access to data was another big trouble at the European level because most hospitals, that's where the data is obtained, in some way were not used to, and research projects were not used to extract, obtain, and structure the data on an easy way. And we spend so much time when you construct a research project pulling the data, obtaining the data, and allocating the data. And by helping this massive data extraction, data structure, and data collections at the European level was also another big piece of need that we foresee when constructing this federated approach of medical images. And we were willing to power up AI by using whatever AI tools we do have to obtain much better radiomic features and prediction models that mean diagnostics and prognostics allocations. We were also willing to use medical imaging as an important piece of information, not alone, also being linked with genomics, proteomics, and clinical data, and integrating all of them to provide a research platform for researchers, which are AI scientists, but also computational scientists or clinical researchers and physicians who wants to construct solutions to treat patients with breast, lung, brain, or colorectal tumors properly. And that means moving into precision medicine on a way solving the troubles we face today, which is federated data warehouses approaches. Touching all the different research projects and hospitals to be linked together. So we will construct image storage, which is anonymized on a secure and safe way to address the fragmentation of existing repositories at the European level that were constructed because of research projects. And by doing that, linking all those pieces of information that were going to be left, we want really to construct this atlas of cancer images. And we were also willing to allow new data coming from hospitals and new research projects to enlarge the huge amount of data we need to obtain a reproducible approach into these prediction models. And to do that, we are creating a federated data warehouse approach, touching the main hospitals at the European level to deploy, to allow fast observational studies to be performed. So this is the overview. On your right, you have the already existing data that were obtained for research, secondary use, coming from the AI for Health Imaging research project, European research infrastructures, clinical trials, and so on. And they will be federated and even transferred to the central storage. And on the left, you have the new data and new projects coming into the ecosystem, linking the so many different hospitals who have a data warehouse with computational and storage capabilities, and also linking cancer screening programs because screening is also an important, extremely important part of research in oncology, and we are also willing to link with the data altruist organizations. And we are doing that for three main, let's say, actors. And those three main actors are the data holders, and we want really to approach them as any person or entities, bodies, research organizations having data. We are approaching them to join the federation, to become either a federated node or to transfer their data once the project or the research or the trial is finalized, transfer that into the data repository. We are also willing to target users to be tool providers, because this is not only a matter of data, it's also a matter of solutions. There are a huge amount of solutions that has been produced in the so many different projects that once the project is finalized, they do not transfer into any commercial solution and they will stop. But we were really willing to allow other researchers to use existing solutions that have to be validated, qualified, cataloged, explained, and checked, and so they could be reused. And even further, they could be enlarged in their capabilities to produce reproducible and high-quality results. And we want really to allow this participation for those researchers having produced AI tools. And we are also willing to, as target users, to allow these data user researchers, which means the community of researchers that are willing to perform research on data, having tools for a clinical relevant question. And our community is based on the willingness to solve unmet clinical needs to help patients to have a much clearer understanding of what's happening to them, and also to allow personalized treatment with more successful rates. That means precision medicine. And for the sustainability of this infrastructure, this is becoming to be not just a research project, but a long-standing infrastructure to help researchers not to invest time and money on data collection, data location, data storage, software development, if it's already done. We really do think that we have to go into this European Digital Infrastructure Consortium, which is a legal entity, fully new, that we do foresee that will facilitate our engagement in this research project. We also want to be part of research projects, so if you are a researcher, take into consideration that you can approach EUCAIM and say, well, I will need maybe place for data or tools or community of researchers linking to my idea. That will be extremely relevant. We also want to be engaged with companies, helping them on the transfer from lab to fab for the commercialization of their products. That's one of the main links also with the TEF Health, we will see. And from the validation and regulatory issues and clinical trials. And we, of course, want to be at least part of this advisory body, or infrastructure when we speak at the European level on data and AI. That's our main role. And that's the last slide. We are within an ecosystem at the European level, extremely related with digital, health, and research, extremely linked to the so many different actors, because it's with the interoperability and the understanding and the benchmarking and the help between all these actors that we might have really an opportunity to help patients with these precision medicine approaches by using a huge amount of high-quality data that is there for the best of their research. Thanks a lot.
Thank you very much, Luis, and fantastic. In this short period of time, we have learned also so much. Great to start with the figures that really open our eyes, and then really how to see that a lot of efforts in research, and you explained very well all this data that is generated in the projects, all these tools, applications, and how all this can be federated and really make usable for the market, but also for researchers. And we will touch a lot on the sustainability. And also it was funny with this, because as I'm also involved in the Data Spaces Support Center, starting to talk, okay, once we build this federated data infrastructure, we need to build synergies with other data spaces. So that's the next story for another event. But thank you very much. Now we pass from the federated data infrastructure to the testing and experimentation facility for health. And here I want to invite two people. So we come from Spain, we go to Belgium and to Sweden. And we have on one side François Roucaud from Réseau Humani. And he is part of the University Hospital of Charleroi, Belgium, and has been coordinating the balloon node of the TEF Health. And we have from Sweden, Päivi Oslin, welcome. And she's actually part of the Karolinska Institute in Sweden, obviously. And he works in the Department of Oncology and Pathology. And he's principal investigator of the TEF Health. Thank you very much, and the floor is yours. Thank you.
Okay, thank you. It's a real pleasure to be here to say a few words about the TEF. And as you have guessed, TEF Health is an acronym meaning Testing and Experimentation Facilities for Health, AI, and Robotics. And first, let me begin by presenting Professor Petra Ritter, who is not with us today. Petra is the director of the Brain Simulation section at Charité University Medicine in Berlin and the TEF Health lead and coordinator. Okay, so what's a TEF? A TEF is a European initiative whose objective is closing the gap in the innovation chain for health, AI, and robotics. The ambition of the TEF is to be the single EU-wide entry points for SMEs or larger companies active in the health sector and who want to access to innovation and validation using data, but also help for testing and pre-certification check of their AI-augmented product. The TEF will reach that ambition by setting up and providing access to physical and virtual testing and experimentation centers throughout Europe. Those facilities are, in fact, essentially research centers and hospitals. So on the slide, if we consider the steps to bring a scientific or a technical product from ID to a marketable product, you have some steps. An ID steps and the inception point of innovation, of course a research step, a step dedicated to data or knowledge gathering. And in fact, these three first early phases are not the main focus of the TEF. The TEF Health will target projects with higher maturity level, and that's related to the few next steps. So you have a next step about data-driven validation, about testing, about certification, and that's the main goal of the TEF. It's to help SMEs and bigger companies during the validation, testing, and certification phases to reach the stage, the final stage of creating a product that will reach the patient and the caregivers. So It is in that perspective that the TEF Health will provide a single EU-wide entry point as a kind of centralized platform to help companies to find and access a rich catalog of services provided by the TEF partners. Okay, you see the single entry point and all the services in the big wheel on the slide. Okay. So that's a map of the TEF and the different partners, and I will say a few words about the history of the project. So this initiative started in January 2023. It will stay for duration of 5 finance years, and after that, the TEF need to be sustainable and autonomous. That's the deal. It has a comfortable budget of 60 million euro, financed half by the European Commission and half by the participating states. The TEF Health in AI and robotics gather approximately 52 partners from all over Europe, and 52 partners mean over 250 people involved. Some of the partners have a great reputation in the health scientific domain because we have in the consortium actors like Hôpital La Charité of Berlin, the Karolinska Institute of Stockholm, the LNE in Paris, and other ones, of course. When the TEF Health was first proposed, over 40 SMEs provided us with a letter of intent expressing their interest in future services. So I say that the duration will be 5 years, and during that period, we ambition to read about 500 TEF users served, and we will try to reach 80% of SMEs. At least a percentage of 70% of cross-border combined services, and that notion of cross-border and combined services is very important for the TEF. In the 500 served users, at least 250 should have started a CE marking procedure or a certification at the end of the project. And at the end, we will also have brought to the market at least 2% of the user project as products adopted, so before the end of the 5 years, by health provider and patients. Okay. Päivi, the floor is yours.
Thank you. So I will continue on our project. So all the nodes within this project will provide different types of services to the best of their expertise. So in principle, we provide for virtual testing facilities, including data, expertise in AI, also legal and ethical compliance and certification. Towards doing so, Francois already mentioned the one-stop shop and the infrastructure existing at the eBrains connected to the health data cloud. And I just want to mention we will use a similar approach as EUKIME in creating federated data infrastructures for sensitive data. And one example is the existing federated node at Charité, which is actually already GDPR compliant. And it's important here to remember that the technical infrastructure also needs to interplay closely with the legal infrastructure. At least we have one use case where this has already been possible. Besides providing data and a virtual testing facility, the TEF Health will also provide for a physical testing facility, meaning real-world environments such as hospitals and hospital platforms, but also research environments such as infrastructures where Francois and myself work that contain expertise on multimodal data in the molecular field. That also then linked to clinical expertise to really make that difficult jump from research to reality. Our disease focus areas is not only cancer, but also cardiovascular, intensive care, and neurotech. We have 10 work packages that I don't aim to go through today, but I mainly want to show you that we're working on both mitigating risks with AI, but also paving way for trustworthy accessibility, meaning thinking about agile certification models and how can we really make a very dynamic field progress in a safe and a certified way. I picked one example, of course, from precision cancer medicine, which is my own field of research, on how TEF Health could be leveraged to really foster the state-of-the-art robotics and AI development. And we just heard a great presentation from the EU KIME focusing on the cancer images field, which is very, very advanced in this domain. But we shouldn't forget that precision medicine is really about leveraging all different data types. And I picked this image from a recent review that I suggest you should look up. It's a very good overview, although the image is still lacking patient-reported outcomes and wearable techniques. But to make this happen, what the patient is really requesting is the stuff in the blue box, as you can see. And the step there to get there is still vast and long. So we have a work package within our project called Work Package 9, which is the demonstration of feasibility. And here we really need to learn and educate people also on how technology platforms need to work on samples and data in a different way. We need unique identifiers and to really make the provenience of data that we don't use the same set of data to train and validate. And we need to be able to track this in the future. So us as researchers, as service providers, we need to start working in a different way. Of course, we all heard about FAIR, but we need to make that happen for real in our infrastructures that generate data. And then also, of course, linking then the analysis part. Analysis pipelines change and will evolve during time. We need to know which one was used. We need to certify the results, and they will also be dynamic and change over time. And needless to say, clinical implementation within the health field will require clinical trials, and there are not too many of them ongoing right now, including AI and this type of multimodal data. So it's a very ambitious and vast project, but I truly believe that by linking the ability to do both physical testing and virtual testing, by talking on multimodal data, from learning from EU KIME on their path, on the long path they've already made, how can we make this journey shorter for the other data types, and how can we make that data really truly unique and usable for the patient? Because it's only in this way that the patient really gets what they need. And they don't want only diagnosis, they also want prognosis. They want survival estimations. How am I going to respond to my treatment? And when's my disease going to recur? And this doesn't only apply to cancer, it really applies to all of the diseases. And we've started to focus on 4 of them, ICU being your expertise and cancer being mine. So the take home from TEF Health today, which is still a young project, 1 year in the making, is that we should use this as a tool to learn how to generate data better from the start and to find the sustainable models. And this is a transition needing all of the field, all the stakeholders in the field. But by focusing also on SMEs, we ensure that the sustainability idea is there from the start. This is not only for the next paper, this is not only for the next cool infrastructure, but this is really to make something sustainable. With that, I'm done, with 1 second left. So thank you.
And please stay here. Yes. Thank you very much. You can sit now, and I think it was a fantastic presentation as well, and very good that we know now that we have this great initiative that is going to help the innovators, the SMEs, the startups. Also, Saila was commenting at the very beginning the whole topic of regulations and how much you are going to guide companies, researchers, and in general practitioners in navigating and implement solutions that really comply. And I like very much, actually, that you talk so much about multi-modality, data multimodality, the whole life cycle of data, interoperability, and quality, and the importance of data for the AI-based solutions in healthcare. So thank you very much. And now we will start with the panel, so we have a bit of something in between. I want to invite Luis again on stage. And then I want to welcome also our fourth speaker panelist, and I want a big applause once and introduce her. Is Yana Chakou, and she comes from the Grupo Maglioli in Greece, in Athens. So now we have another country, and she's part of the UKIM team and leading One World Package, but very important, she's coordinating one of those research initiatives that is linked actually to UKIM. First, big applause for her. And well, I asked the colleagues to move this table away. We just want to establish a very short dialogue with you. It's going to be physical, not digital. So we have the digital and the physical. And our panelists and I would like to know a bit more about you. So you need to make an effort and stretch a bit. So we want to know in this room how many of you are working more on the policy making side. Raise your hand if you are on that side. But very, okay, good. Who is more on the medical profession, really a practitioner on the medical side? Good. Okay, more, stretch. We need to guide with example, Luis. Very good, less people. How many of you are researchers? Good. We have good, and then we look at companies in the room. Oh, we have good. Excellent. I'm very happy to see that we have good representation. And how many of you really dedicates more than 80% of the time to AI in your jobs? Okay, so quite a lot of people with, you are all very shy, no, come on. And then who is really focused on AI for healthcare as 80% of your job? Okay, so we have, of course, the so now let's come and let's begin. And all those questions that you had while our speakers presented, you can also ask now. So we will try to have an interactive session, and we have colleagues helping with the microphones. But I will also let you know when is the best moment for these questions. Let's start with a bit more the general but important aspects of the value of AI in healthcare and where we are going. And now I want to start with you, Yana, because we didn't hear from you. And we want to know a bit more, although we heard a bit already, how AI can contribute to improving patient care. And in general, give us examples of really how AI is helping the healthcare sector.
So thank you very much for the introduction. Indeed, AI can be a very significant tool in the hands of healthcare professionals. And I will start the reply to your question by stressing the word tool. Because in AI in healthcare, we never think about replacing the healthcare professional. The healthcare professional is always in charge, is always in control, and AI is a tool in their hands. And with this tool, they can do a lot of things. It can significantly speed up the work of healthcare professionals. It can also help in the overall workflow in almost all parts of the medical workflow when we have patient care. And it can do that by providing decision support services or by pointing to them specific patient characteristics that may be important to take into account when planning the care or diagnosis and treatment of a specific disease. So, in fact, AI is a major enabler for precision medicine and personalized medicine, which we are all aware that is really the future in medicine. It can help also in the logistics of care provision. For instance, in the Incisive project that I'm coordinating, we are building patient prioritization services. We have these huge screening programs, cancer screening programs in all countries, all EU countries. And there are thousands of imaging examinations being done as part of these screening programs. how do you prioritize cases where there are specific suspicious lesions that medical professionals should look into in more depth with more precise imaging modalities and determine if there is cancer or not? AI tools can really help in that. They can significantly speed up the work and help in this regard. Also in precision medicine, in another Age 2020 project, research project, we are training and validating AI models that can provide decision support services to healthcare professionals about whether neoadjuvant therapy in breast cancer treatment will work for a specific patient. And this is very important because this kind of therapy has a lot of side effects. So if we are able to predict in advance if this therapy will work or not, we can spare the patient from the side effects if it's not going to work for them. So many, many significant ways, many examples, but I don't want to spend more time. Allow my colleagues to also comment.
Of course, and it's true, this is, I mean, we could speak the whole day about these benefits, but I very much liked your first comment about AI being a tool. And I think I was reading quite an old report already for the World Health Organization saying, no, in 2030 we will have 40 million more jobs in the sector. However, we will have a gap of 9 million in those ones that are really needed for the patients, like the nurses, the doctors. And then what can we do? So technology can help to move the doctors and the medical professions really where it's needed, that is really to support the patient. Very good. Any other comments to this question, Päivi?
Yeah, I also definitely see the potential here, but I also see the long journey we have towards this multimodality in creating those data sets, in learning our profession, how to prepare for a digital future where AI is a powerful tool in our hands. And that's kind of the main message I want to stress. I do think we all acknowledge the potential in the room, but we also need to have some realism on the small, tiny, really, really important steps that we need to make data interoperable and really work towards our common goal.
That's important. So identifying these challenges. So we have big dreams, but we need to do our baby steps and really make sure that all things are in. Any particular additional comment? Everyone wants to react on this, or otherwise, I won't really jump into something very important as well. That is, looking at people. We care about people. And we've been talking about the regulations, and we talk a lot about ethical consideration when we talk about AI and when we talk about data, right? So we want to know a bit about this societal perspective, ethical perspective, considerations about AI, aspects of data protection. So what are the specific challenges that you see in healthcare in relation to ethical AI ethics, data protection, etc.? I don't know who wants to answer, maybe François?
Yes, one, as a doctor and as an IT director in an hospital, I am quite obsessed by confidentiality and privacy issue. So as you know, medical data are quite sensitive and intimate data. And when you make AI, of course, you will share that data, you will move it, and that increases, in fact, the risk for patient re-identification. So we know that we can use techniques like anonymization, pseudonymization, but we know too that when we share data, when we cross data, the risk of re-identification increase, in fact. And so we need to mitigate that risk. There exist techniques with barbarian names like homomorphic cryptography, like multi-party computation, like differential privacy. And we need to ensure that the AI practitioners know that techniques, know how to apply them and when to apply them correctly. So yes, that's the first challenge.
Yeah, but then the techniques, in your opinion, are already there. Is more the usage of those techniques, or do you think still we need to work more on being more, or to have stronger tools in that sense?
Yeah,
still to also work in having stronger tools. And I saw in the UCAN project you were presented all the layers. I said anonymation, fantastic. And maybe Jana or you, Luis, can you tell us from your project perspective, what are these challenges both on AI and data ethics and
I can start, and I'm sure Luis will complement. So we look at ethical and legal issues in two dimensions. There is the data privacy dimension, and there are a lot of ethical issues, and Francois has mentioned some of these relating to data anonymization, robust methods, also measurable ways of measuring the risk, quantifiable ways of measuring the risk of data sharing, of patient re-identification, but also operational and technical means to ensure that the data access processes are well defined and robust. And we are aware at all stages of this data access process who is doing what, who is accessing which data, and how safe this is. So lots of challenges there. But even assuming that we have resolved all these challenges and we have managed to train and validate AI models, AI tools, there are still the second dimension of ethical and legal challenges, and this is those related to trustworthy AI. How do we ensure that the AI tools are fair, they treat all patients in the same way, that they are traceable? We know all stages of the process of developing and using them. How do we ensure they are usable, they are explainable? In other words, how do we put the medical personnel or the users of these tools in charge of the AI? How are they aware fully of the whole process? And this is where our projects can offer major help. We don't have all the solutions, obviously, but we do offer tools and data required to meet some of these guiding principles of fair AI and to operationalize the building of these principles from the very early stages of designing and planning the AI tools up to the stage of training and deploying them in real practice. So it is important.
Very good. Yes,
just to add other points, within EUCAN, we also provide, I mean, we know the relevance of pseudonymization, anonymization, and so on. So we provide tools on how to do that on the best way. And that's extremely relevant because that helps researchers and places to use the right tools to do things how they should be done. But even on the other way, I mean, at the European level, we will never agree on the different approaches because different countries, different regions, different hospitals, different data protection officers might have different opinions on the same issue. So to avoid that, we trust on the safety by design, meaning that we are approaching on a federated way. So putting all those, let's say, responsibilities at the local level, and you have to do things properly in your hospital or your research project, and we will then be federated, meaning that the tools or the computational algorithm will move and not the data. So in some way, we will minimize whatever issues related to safety and security. So doing both things, the right tools or the best tools, and also allowing federated AI, and sharing data but not moving the data is our understanding that we may do things better.
Very good, because actually you brought up the topic of diversity, of how to approach this with different viewpoints and from different locations. And then, of course, we bring federations, safety by design, as you said. Very interesting also to see that this re-identification of the patient seems to be a key topic, and still we need to not only to work with the tools that we have, but to develop more tools. And definitely, yes, the topic of trustworthy AI, how we are going to implement all the new regulations and all the tools, the life cycle of all the systems that we need to, it's a lot of work in front of us. So that's an important steps now ahead of us. Now, I go back, I liked so much the comment from Saila about the ecosystem perspective that I need to touch on the specific stakeholders. I mean, we have representation with Francois Louis from hospitals. You know, and when we are talking about technologies, and then hospitals is where the action takes place, no? It's one of those places where the real action takes place. So what is the role of hospitals in these innovation ecosystems? How you are really facing these innovation projects, and what is your role? I don't know who wants to start. Maybe Francois, you first.
I can start. Maybe one of the main obvious role of the hospital is a kind of data source, of course, because AI needs data to train and to evolve. On that domain, there is also some challenges in the hospital, because today, in terms of data quality, data structures, we are lacking. So we need to improve our data collection infrastructure, our data labelization processes. So yeah, that's maybe the main role of the hospital, is a kind of data steward. Data
Interesting, no? If we go to the streets and we ask people, now your hospital becomes a data provider, no? And we will touch on the data quality in a moment, once I hear the opinion of Luis.
Yeah, I mean, hospitals are pivotal, no? They are extremely relevant. That's where medicine is being taken. And I do think with these actions, we have to think on two ways, no? One way is hospitals are providing data. That's great. No? We need data to perform research. And data have to be structured, high quality. We need data coming from things that are now brightening. I mean, hospitals need to be digitalized and following all the efforts of structuring the data. And we have to help them. And in some way, within EUCAIN, we are trying to help those hospitals being involved. Now we have 21, but we want really to expand till 40 or 60 as much as possible, to have their data warehouse structure in a similar way, fulfilling all the requirements, standards at the European level. In that way, we will help hospitals to organize their data, and we will help researchers to have access to high quality data on a much faster way. But apart from that, we need hospitals, because the questions we want to solve are at the hospitals. I mean, why do we need to perform genomics or radiomics or integrating laboratory issues with clinical? Because we realize that we have to perform much better medicine today or tomorrow. And to do that, we have to raise the right questions, and we have to solve with the right tools, as Jana was saying, those questions. So at the hospitals, we need also to engage physicians and researchers to think the clinical need we should answer.
Yeah, and it's interesting, on one side, the hospitals as data provider, as you said, hospital is where everything happens, and then linking back with the presentation that you did about the TEF Health, where maybe you were talking about, okay, and we have also the physical test bed, and that's where the hospital really takes really a big part. And just maybe a question about the data quality. I'm personally very interested on that, and you have mentioned the importance, Francois. It has happened in all your interventions a bit about the data quality. What is happening? What are you doing? What do we have to do to improve this data quality? Just a bit out of the road question. Anyone has any ideas?
I can start.
Oh, that's great.
That's one of our major pieces of work in EUCAIM,
wow.
and the one that I'm also involved in. So there are many dimensions in relation to data quality, from how well the de-identification process is done up to data interoperability. So once you have de-identified the data and made sure that all the relevant information that does not need to be there has been removed, how do you ensure that the quality of the images, for example, is appropriate, gives the right information to the AI tools for training the AI tools? How do you ensure that there is homogeneity in the data? Because it's not possible to train fair AI tools and well-performing AI tools unless you have homogeneous data. So we are building tools that help in this kind of data homogenization. And since we are talking about data federation, as Luis stressed, the data remains at the place where it has been originally collected. How do you make this data interoperable? Because each clinical site is storing the data in their own format, using their own data models. How do you make this data interoperable so that it's possible to use? So lots of things.
Very good, and very different dimensions from the quality of the data itself of really, can we use it or not? And yes, please, what...
Yeah, just a small remark.
Yeah.
I think that we don't need. It's important not to forget that the caregivers, so the nurses, the doctors, are not in the hospital to collect data. They are in the hospital to heal patients, and data collection is, a peripheral activity of what they do. And in that domain, I think that the tools used to collect data, to label data, need to be improved. And AI is clearly key in that improvement. For example, system to automatically or interactively extract information from textual, unstructured data will be very, very important, and so you see my point.
I see the point very well, and I actually like very much when you said, no, but the professionals, they cannot become now our data collectors. I go and collect. No, you focus on what really matters. And then it's true that also AI is helping for data in the same way that we need data for AI. So this is like a good marriage, no? Thank you. I think it's important part that we need to really go more, work more on these tools for data collection. Pevi, you want to do a final comment on this question?
Yes, no, I just wanted to lift the pivotal role also of researchers in this field, in that we are also data providers, and we also need to make sure that the data we provide is really fair and of high quality in that sense. And we often focus on the primary data coming from hospitals, how hospitals need to learn. I do think we have the same journey within the research field as well, which is often much more scattered and driven by different types of incentives in this respect. So what I'm maybe hoping to come out of this project is that, you know, it will become more easy for a data provider to do right in an ethical and legal way, but also provide high quality data, and that we just identify easier ways to do so.
Very important point. I was the last one. You can add something, and then I will comment, and then we change the section. Luis.
No, I was going to reinforce the importance of facilitating at the hospital level the way to fulfill the health records. I mean, that's extremely relevant. I do foresee that doing that with the help of tools that will be critical. That's something that the hospital will see as a benefit of being part of this research project. But I do really foresee that we need, let's say, a quality stamp for those hospitals that are fulfilling their data in the right way, because those should be the ones that have to be engaged on research projects, trials, because they qualify for data recruitment, which is extremely relevant.
So you are suggesting kind of data, like quality label for hospitals that know how to deal with data, so we leverage AI in the hospital. That's interesting. And thank you, Päivi, for bringing up the point of researchers, really important. Also as data providers also in this, and very important that we need to consider their input as well. Now for the audience, we are closing a bit this discussion around the value and the challenges on AI in healthcare more generic. And we are going to move now into the real, how the Horizon Europe, Digital Europe program, how they are really helping, what are the challenges, how different programs collaborate. Before jumping them, I don't know whether there is any particular reaction. Okay, there is one question here from the gentleman. And please, when you intervene, say your name, your organization, and then...
Yes, my name is Marcel Lucht from Arcadis Telecom, and I actually have two questions to the panel. First of all, you mentioned, Jana, that the data, the AI data, should be fair and treat all patients the same. However, how do we prevent that we run in the same problem that we've run in medical data in the past, that because of differences between, for instance, women and men, data are being skewed towards one dominant research field? So I would like a comment on that. And thank you very much, Francois, on your words about privacy. A concern I have, if you start sharing medical data, it was already mentioned that medical data is very sensitive, especially with NIS2 directive impeding as well. One of the things as a telecom provider I see is that a lot of research facilities and universities do not yet request encrypted data lines. So what's your position on that?
I'm totally on yes, on your side on that point. Yes, indeed. From my point of view, when we transfer data, in fact, we shall do end-to-end encryption. And there exist, yes, techniques on software level, but also on hardware level. So we can, for example, analyze data on a protected hardware processor and so on. So yes, I totally agree with you. We need to enforce encryption. We need to enforce security in that domain, certainly.
Very good. And for the first question, who wants to react, Jana or someone else? Do you want to react to the first one? Excellent.
Yeah, thank you for the question. It's really a very important one. And the question of fairness of data and AI tools is definitely a huge topic. And I don't think any of us claims to have the full answers. So, but at least we need to address this both at the level of the data collection, make sure that when we collect the data, we label it properly, we collect all the necessary information. And again, there is a fine balance between the legal ethical issues, how much information can you ask the patient to share, because you need this information to make AI fair. And where do you stop? Because there are obviously important privacy issues. So one level is when you collect the data, we need to make sure that we collect the right type of information, we label it properly so that when the AI training and validation will take place, it will be possible for the AI developers who hopefully are aware of the importance of fairness and have already a plan in mind on how to address these aspects. This is very important. We enable them to search for the right labels, for the right type of data that will help them in ensuring fairness. And the third part, which I think is equally important, is how do you monitor the AI performance after it has been used in practice? How do you make sure that the fairness remains there? And of course, there are many ways to address this, not in a complete way, but at least you need to ensure that in different clinical centers, this is well performing. And yeah.
There are two comments, but please super short, because we need to jump into the very important discussion on the research to reality. Päivi, raise hand first, and then you, but please very short, and we close with this to the next section.
I would say the gold lies in having diverse training data. So we need to ensure that each country will provide for a very representative and hopefully deep data, not only on like the human genome of Europe on genomics, but on the multimodal level. So I think each country will have a lot to do in doing so. That was my short answer.
Excellent. You want to add something?
So you mentioned biases. I'm sure that biases are one of the main challenges of AI. We know that if the training set are not too diverse, we will have problem, and these biases will be perpetuated and augmented. And we speak about federated infrastructure. Federation is one of the means to increase the diversity of data sets. So yes, but certainly it's quite important, that aspect.
Okay, excellent. Thank you very much. Thank you for the question. It was extremely relevant. And now we move to the second part of the discussion. That is more, again, we are into research to reality, how the European programs are helping, and also how we build these synergies. I would like to start a question for each of the initiatives, so one each replies. So your initiatives are part of Digital Europe program, and for what we heard in your presentations, they are leveraging on previous projects. But now looking at Digital Europe program, deployment, larger projects, the whole value chain, all the stakeholders, these big projects. What are the main benefits of having these big projects, and what are also the challenges of these deployment projects, of course, applied to healthcare? Who wants to start? Jana?
Yeah, sure.
Perfect. You can come first.
So yeah, lots of challenges. It's really important. I would say you cannot have a proper deployment project unless you involve all the relevant stakeholders. And of course, this is important in research as well. But in deployment, it's really imperative. It cannot be done without this. And for sure, the challenges of involving all these different types of players are many. They speak different languages, literally and metaphorically. So they come from different backgrounds. They bring their own expertise, their own perspective. And there is a need to spend quite a bit of time, especially in the planning and design phase of the project, to build a common understanding, to build a common vision so that everybody works towards the same goals. And of course, a common implementation plan, which is even more challenging. But this raises the complexity a lot in the design phase. At the same time, it's a huge benefit when it comes to the real implementation and deployment, because once you know all the relevant requirements, you're able to build this complexity incrementally in the implementation plan and be able to account for all the relevant needs, all the relevant wishes and possibilities. And last point about this, we need, if we want to have deployment in real life, we need this connected ecosystem. Each player has their own role, so it's important that everybody is involved and know in advance how this may work operationally.
Very good. Very interesting, the fact that these projects really need these longer periods of time. And it's true. I mean, so many stakeholders, so many cultural backgrounds, understanding of the same topic from different perspectives. It takes a lot of time until everybody understands, uses the same language, and we can build things together. Interesting point. Of course, the other two very important as well, but I want to hear from the TEF Health. What are the main challenges and benefits of these deployment projects?
Yeah. No, I think Jana describe it very, very nicely. I would tend to agree on the multi-stakeholder challenges in this, but this is the only way forward for a deployment project, and it takes time. We need to build trust. We need to be able to agree that we don't know how to solve this, and really, be stupid together and find the solutions, because it's not always about a difficult research project. It's really about how we organize our work. I would actually say the process is important here. Coming to good results is key. However, we are stuck to grant addictions, like we heard in the opening session. This is very much the difficulty in working in this field. And I think large deployment projects like EUCAIM and TEF Health are good examples that can become sustainable, and we will need more push on these types of projects to really make a difference and force us to meet and close the gaps that we are currently having. I probably never would have discussed ICU if it wasn't for TEF Health, you know, and learned so much already in the year that we have been active. So it's a great way of connecting experts across Europe, but that takes time.
Yeah, and actually about the sustainability we will discuss in a moment, but yeah, the message that to move the, to build ecosystem takes time, but at the same time the field moves so quick, so somehow we need to find solutions for that. Francois, you want to comment?
A small comment. When PV and I presented the TEF, we mentioned that one of the goals that we want to reach is to provide coordinated and cross-border services. The idea is to avoid competition between centers, between hospitals. I have a better CT scan than yours. I have more patients than yours, and better data quality. That's not the idea. So the challenge is that the users of the TEF see the services like pathways in Europe to bring their project to a product. And yeah, today it's a challenge. We try to create that vision, but it's difficult.
Yeah. Now thank you very much, Francois. Now we are going to look at synergies between Horizon Europe and the Digital Europe program. So as you mentioned in your presentations, in particular it was very clear in the presentation of UKIME, and also Saila commented on how these roadmaps are built from research to deployment. So give us some inputs about your experiences in moving these results from research to deployment. Lessons learned, things that we need to improve in the future to move things from research to deployment. I would like to start with Luis.
Yeah, well, thanks. In some way, my understanding, that's something like the level of maturity, no? We were extremely used to research, and we knew how to do that and how to take care on biases, equities, and methodology. But now that we have to transfer that into a deployment and infrastructure, something that will stay there forever, and we have to go into interoperabilities, common data elements and models, sharing, semantics, technical interoperability. I mean, there's so many different aspects of trying to be linked, no? And to understand each single project within a common ecosystem. That was a maturity, a second maturity level from my point of view, extremely relevant. And that's why I really do think we, thanks to the Commission, this is the right way to do things. I mean, from what we learn at the research projects and then transferring that into a stable deployment solutions like the infrastructures.
Any comments? Thank you, Luis. Any comments from Peggy or Francois from the TEF Health, from your side, this connection between Horizon Europe and deployment projects? Who wants to react?
Well, it links to my previous comment. I still think that research is an integral part of even deployment projects, in that you do need to include researchers as a stakeholder in deployment projects, because also the technologies, the knowledge we have is moving very quickly. And to ensure that deployment projects don't come out of phase, there needs to be a close connection between, I would say, even on the program level, Horizon, and the deployment.
Okay, very good. So it's not only transition from research to deployment, but the deployment needs to come continuous inputs from the research. So that should be a continuous flow of. Okay, very good. I have one question about the synergies between the two, but before I look to the audience, and maybe we have experiences or questions around deployment projects connected to healthcare, or connection between Horizon Europe and research projects to deployment. No reactions. Okay, so I come to one of the major questions, even when we are heading towards the end. Your project, UKIME TEF Health, I mean, we saw kind of different objectives, but super complementary. So you are developing tools, and we could see one of your central target audience are these players developing or deploying these tools. And you, in your presentation, clearly talked a lot about access to data, very clearly said, okay, different types of data, multimodality, but there is a lot of connections here. So how are you collaborating, and how you envisage this collaboration towards the future? Who wants to start?
Well.
And if you have done already something, we would like to know as well.
I can say something.
Excellent,
also.
Luis.
Well, in my understanding, well, there's a huge amount of links, no?
Yeah.
And thanks God we already started on channels on communication. The two main channels, at least from my understanding, have to be with how data is annotated. I mean, the metadata, the catalogs, the interoperability to understand the radiomics or medical imaging part together with the genomics, clinical data, to have the same words for the same things. That's extremely relevant.
Same glossary, same ontologies.
Yeah.
Okay.
And I also do see a need to define the benchmarking also. I mean, how are we going to qualify, compare, evaluate not only results, also tools and data, and so those aspects on metadata and catalogs and benchmarking of solutions and quality issues as an example, I'm pretty sure those will be extremely relevant aspects to be to work together.
Yeah. Your perspective.
Yeah, sure. So I know that we interact already on a leadership level in advisory boards, exchanging that level of information. But maybe I would like to bring an example from Sweden into the discussion, in that we are already having a national coordination project amongst the TEF Health and the EU KIME, specifically then Katrina Riklund being the Swedish node lead. But that also includes genomics data infrastructure and the European data innovation hubs, because we do see a lot of practical overlaps, already the ones mentioned here, but also on the legal side, that also sometimes need to be adjusted to the country-specific levels. So I do see that in these digital programs we have a lot of synergies to be made, but these synergies do not happen by themselves unless we make an effort in really making sure that they do. I think also the workshops that were arranged by the Commission were very helpful already on the cancer workshops, and also opened my eyes as to the vast resources existing within EU KIME, and learning specifically on these metadata levels and how we could, by cataloging, so we are currently in the process of cataloging all our services, looking and into making knowledge graphs, and by doing so we can, in practice, link the services and models we develop.
Very interesting. And so then my summary of your input, because this is very, very relevant. So very interesting the part that, okay, we have these European initiatives, but then at the national level, we also meet up, because it's not only about the two of you, right? There are many others, and to organize everyone everywhere is complex. So it's good that we have these national, regional chapters, and it's very good that we put the EDIs, the European Digital Innovation Hubs, and then we'll talk about the EDICs later. So that's very important. Also, the European Commission as facilitator, as really making sure that these things happens with different workshops. But the points before, which I find extremely relevant, like less aligned on the metadata, less aligned on the terminology, less aligned on the glossary, less aligned on the benchmarkings. Because you mentioned before how difficult it is to coordinate the whole ecosystem. So we don't want to build one ecosystem there, very different than the ecosystem here. So that's, it's complex, because now it's an ecosystem of ecosystems, no? It's a super system here. So you have a lot of work to do. Any comments, reactions from everyone because we really could stay longer here. I wanted to ask them, how do you plan to collaborate now on the times to come? But I want to jump also into sustainability. So I want to know whether there are any reactions about the collaborations into projects. I think they were so good inputs. Okay, there is a gentleman there. Yes, please take the microphone. Please brief, as we are really heading to the end. Thank you very much.
Thank you, Ms. Chairman. Ms. Chairman, good morning, citizens. My name is Angelos Harlaftis, Epafos Advisors, who represent here Gyra's aging communities. The question is simple to all the projects of the Commission and of the Union. What will be the commercial impact? Because we are facing a big competition from the big tech, and our responses are very weak. Thank you very much.
Very good. So I will maybe look into the TEFs, as you are really supporting startups and SMEs. And of course, we had presentations before in the plenary about the European Innovation Council, how really these things are helped. But any quick remark from your side to the question?
So, Francois, you had the nice KPIs of our project that you mentioned in the introduction, but these are, of course, estimations. So we cannot say, you know, this will be the actual result and impact. But there was a lot of, I don't recall them by heart. Do you remember?
So on the KPI, what we expect at the end of the TEF is that we will have served 500 SMEs. And so the idea is to bring them to an advanced stage before product commercialization. That's the idea. But also, we are quite realistic, because on that KPI, I mentioned that we expect only a few % of them will have completed all the stages, and for example, long ones like certification and so on, before the end of the TEF. So that's
the goal. Or
it's
the
ambitious,
vision.
but also realistic.
Perfect. And Luis, you wanted to do a short remark as well?
Minor remarks. Close to 40% of our partners are industry partners, so that's an engagement. We do foresee, we are extremely linked to the technical companies on medical imaging, helping to foster AI reconstruction and recognitions on their machines, and also on the pharmaceutical companies, allowing them to perform much faster and cohorts into trials, clinical trials. No? And of course, for startups, I mean, we do foresee that having access to a large data lake and a structured data repository, at least those startups linking to medical imaging, will facilitate the transition from the early days to a more mature business. And it's also in our heart to help the business field at the European level as much as possible.
Okay, thank you, Luis. There is another question. We are a bit out of time, even when we started a bit late. I'm sorry, but there is a question there, and we really need to close the panel. So we will offer one more question, and my apologies. We just need to do the final round of and to close. So my apologies for this.
Thank you for your presentation. Here's Denis from NLSKL. So my question is related to the budgets. Based on your experience from the hospital side, what departments has this budget for AI innovation and adoption?
Well, maybe I can say a few words, because I'm deeply engaged on that. At least in my hospital, it's not department-based, it's hospital-based. And it's the hospital who is leading through a specific budget the AI adoption. And to do that properly, we are going through a health technology assessment. That means which solutions are already approved to be used at the European level, are a medical regulatory device. And then just today, we are discussing on to which departments, which tools should be acquired this year. And this is something in Spain, it works like that in public hospitals.
Do you want to react, Francois, something from Charleroi?
No, in fact, I suppose it depends of the hospitals and the strategy of the hospital. For example, in CHU Charleroi, we decide that ICU is one of our flagship, and so we dedicate a significant budget part to that department. But yes, it's a local strategy, of course.
Very good. So now we need to close, and we are going to close with the question of the million, that is sustainability. I will address you all, and you have been touching on the importance of sustainability, but I want you to put now on the table in the closing this, let's say, your wishes in terms of what are the needs for sustainability in this project. So I will also, if there is any recommendation in your closing note for anyone who wants to engage in your projects, we start from Päivi, we go all the way here, and very, very brief, please.
So we have specific work packages on trying to create business models and sustainability in that we do need to identify also new ways of attaining that to get rid of the grant addiction, so to say. However, even if we don't have a clear answer as to what is our business proposal towards the end of the business model that we will have, there can only be benefits in finding the synergies between our projects and trying to make some sense out of health data and how we create it. That's
Thank you. Thank you, Päivi. François?
I have a suggestion, or a take-home message that will contribute to that aspect of sustainability, but maybe not for the project, but for the SMEs that will participate. My advice is, please, I mentioned that the TEF is focused on the high maturity project, but in the inception phase of a project, when you have an idea to use AI for health, for medical robotics and so on, please have a contact with caregivers, discuss with them about their needs, their pain points, and so on. Why I say that? Because I see a lot of projects that I consider as gadgets. That means that the project is, yes, clearly very okay. The project is interesting, but it not corresponds to a real need. So the care, the domain of care has some difficulties. We know that national health system has difficulties. If you provide a solution that increase the difficulties, is not a good idea. If you provide solution that will be used by patients that are, for example, obsessed by measuring everything, it's not a good idea. So please be in contact with the caregivers and respond to the real needs.
Very good. Responding to the real needs and high maturity projects. Jana?
Yeah, I would like to comment more on the human side, and I'm sure there are several thoughts in all the projects about different business models that could ensure sustainability, but we cannot really have sustainability if we don't engage all the relevant players. And by engaging, I mean we need to get away from this narrow notion of project, EU-funded project. No, it's not about an EU-funded project. And I'm very happy that our Commission officers in the beginning, since the very beginning of our projects, have been stressing that this is a deployment project. It's not a funded project, it's not nothing. So we need to get away from the notion that we do things because we have some objectives in our project. We need to really engage and make all the players, including ourselves, believe that there are services, certain services that we need to offer afterwards. To me, this is a key dimension of sustainability, regardless of the business model that each of us will adopt.
Very good. Thank you very much. Luis, you have the final words.
We're just thinking how to complement that. In my
course.
understanding, we have to go to precision medicine to be sustainable. We do foresee that medical imaging and radiomics provides an extremely relevant piece of information, and that will mean that this will be sustainable. And we understand we are providing services to companies, industry, pharmaceutical, clinical trials. That means sustainable. And we understand also that we will provide tools and data for researchers for further improvements, and that means that we are sustainable. So in some way, we should be sustainable through all these pieces of
So the users
pathways.
should make you sustainable, but yeah, if you're not sustainable, we put all the users down. Okay, that's important. A big applause for the panelists. Thank you very much for being here. Luis, Jana, Francois, Päivi, and I hope you enjoyed the session, and we will see you out there for additional questions or comments. Thank you very much.
Thank you.
Thank you.